Hello, I'm Dr. Herman, and we help people with chronic and acute back pain and sciatica pain. And today we're with a patient of ours. This is Linda, who's with me for I think about 5 weeks right now with care for her back pain problem, and she's all smiles right now.
Yes, I am.
Yeah, and I'm just going to let her talk and share with you of what her experience was before coming in and what it is now.
Okay. You want me to hold this?
Sure.
About three plus months ago, I started having extreme pain in my back, in my hip area, down my leg, in my foot, to where I couldn't sleep at night. I couldn't sit, stand, lay down without extreme pain all the time. So I tried going to a chiropractor for about a month and a half, and I got massage therapy, and it really didn't even take the edge off the pain. It was still just as intense. I would be sobbing at night, not only from the pain, but from exhaustion. If I got 1 to 1.5 hours of sleep at night, that was a huge thing. I basically couldn't do anything. I had to stop watching my grandbaby. I did very minimal housework. It was just surviving. And so my husband went online and started looking for help for me and just typed in the word sciatic because we thought maybe it was the sciatic that was having a problem. And Dr. Herman's website came up, and he wrote me out the phone number. I called them, and they asked me to come in for a free consultation. And during the consultation, I told him everything that was going on. He did neurological testing, which showed me that he was much more than just a chiropractor. He was caring for the whole body. He was finding out the brain function, how that relates to the rest of your body. And it definitely impressed me. The testing showed things were off, and he assured me he would be able to help me. He saw me limping in, not really able to smile at all, and complaining a lot of how intense the pain was. Now, before I came in, I had watched some of his testimonials online, and there were people that were talking about coming in with pain level 9 plus. After 2.5 weeks, they were down to like a 2. And I just sat there and looked at that and said, could that be real? Could that really be happening? Is that actually a possibility? Because at that point, I was just in so much pain. So when I went in with expectation, and after doing the testing and seeing that he really knew what he was talking about and really believed he could help me, I went ahead and started the therapy. And I am one of those. I mean, after 2 weeks, I was walking in, I was smiling. I went from like 1 hour of sleep to 7 hours of sleep a night. I could sleep longer if I didn't have to get up and do stuff, but now I can get up and do stuff. And I'm actually watching my grandbaby again. It's like really like getting your life back. So I have been very excited about doing my own testimonial because of how much I have been helped. And I just really encourage you, if you see this testimonial, you're in that kind of pain or any pain at all, he has made a huge difference in my life. And go Dr. Herman.
Thank you. And we had actually found when we finally got the MRI
Yes.
was 4 herniations. in the
That's
back.
right. I forgot to mention that. We did get an MRI done, and I had 4 herniated discs. And that was, the severity of my pain was stemming from that. And I can say now the pain in the hip, down the leg, in the foot, and in the lower back, which I would say before was a 10 plus. I feel it now when I overdo, which I'm trying very hard not to. I would say most of the time it might be a 1, if even that, as long as I'm careful and doing things right. I have gone back to pretty much a normal lifestyle.
That's great.
So I am very thrilled.
And medications, you're not a medicine person, but
I'm not.
somebody did sneak something on you one time.
Yeah, I was in such pain that I had different friends that had painkillers, and they would tell me, try this, try that. And I tried some pretty strong medications, and they didn't touch the pain. Nothing at all. So I stopped. I was popping 4 Advil every 4 hours, and even that wasn't doing anything at all. And now I'm taking nothing, and I walk in with smiles.
Yeah. All right.
And I'm very, very, very thankful.
Great.
Very thankful.
All right, Linda, thank you.
Yeah.
Thank you, and we look forward to helping you too. And you can call the office at 954-370-3100. And thanks again, Linda.
You're welcome.
Okay.